medicine ko.
Reynaldo Abacan Jr. has spent the past decade dealing with staggering out-of-pocket expenses for his kidney treatment. Although PhilHealth shoulders 90 sessions of hemodialysis, Reynaldo still spends roughly 700,000 pesos yearly for medicine and other treatments.
Napakataas po ng rate na mga namamatay ng mga pasyente dahil hindi nabibigyan ng tulong.
This is why Reynaldo was looking forward to the implementation of the Universal Healthcare Law this year. Signed in February 2019, the law provides health insurance to all Filipinos.
Kasama po din mga libreng laboratories tsaka mga medicine po. Malaking tulong po yun.
But the coronavirus pandemic happened, forcing PhilHealth to delay the Universal Healthcare Law due to shortage of funds. The agency covers testing and hospitalization of COVID-19 patients. The Health Department has over 100 billion peso budget for health services and programs this year, but most of it is now spent fighting the coronavirus. The government set aside 374.89 billion pesos for the COVID response program after realigning funds to set up quarantine facilities, expand testing, hire health workers, and support affected residents, industries, and workers.
Maraming hindi pa alam dun sa virus. So lahat ng bansa nag-struggle talaga.
Altogether, the government and the private sector have provided over 8,000 facilities, 14 mega quarantine sites, and over 70,000 additional beds. From just one laboratory, the country now has 89 labs testing for COVID-19.
We were able to already test more than 1 million people here in the Philippines. No? So pag tinignan mo yan, medyo at par naman tayo sa ibang bansa.
University of the Philippines Professor Dr. Gene Espero says the pandemic has unraveled and aggravated the weakness of the country's healthcare system. Hospitals are short on resources and staff, especially in the provinces.
The Philippine healthcare system, even before the pandemic occurred, ay mahina na. Hirap na hirap siya, no? Yung mga outbreaks ng halimbawa sa dengue.
Critics have noted that the government's COVID response is militaristic, focused mainly on disciplining the public.
Isang public health emergency is the fact na walang expertise yung mga military officials natin. And at the same time, very worrying din kung yung ating Department of Health Secretary ay hindi kaya mag-assert ng maayos.
Paano mapapatupad yung physical distancing? Kung nakatira ka sa mga lugar na sobrang densely populated, hindi yan inasikaso.
But the government insists all its actions are based on science and data. The Health Department has assured other health services are rolling out.
We were able to establish that pathway where people can still go for essential services other than the COVID services.
But as a non-COVID patient who's also facing a life-threatening disease, Reynaldo feels neglected.
Madagdagan nila yung treatment na 90, provide ng tama yung gamot, tsaka yung mga serbisyo mas mailapit sa tao. Kasi yun talaga yung kulang eh. Para ka pang namamalimos.
Reynaldo hopes the pandemic has made officials realize the importance of the people's health to a nation. He looks forward to reforms that would fix what's broken in the healthcare system. Carolyn Bonquin, CNN Philippines.